Hi, thanks for joining us on Focus Washington. I'm Karen Hanratty, sitting in today for Chuck Conconian. We have a very special guest. We're very honored to have Mexico's Health Secretary, José Ángel Córdova, joining us. Mr. Córdova has been hailed by the New York Times, the World Health Organization, and the CDC for your very efficient and transparent handling of the H1N1 flu virus last spring. And I'm hoping that, as we in the United States and in Mexico are preparing to deal with round 2 of this flu epidemic this fall and winter, if you could share with us some of the lessons that you learned last spring.
Sure. Well, the first lesson is that the virus was not so aggressive that we thought before. It's really different than the H5N1. It's a virus with lethality and transmission like the seasonal virus. And the other lessons that we had as we need to have these laboratories with PCR ready to do all these tests. And to prepare for this new wave that we will have on the next winter in the hospitals with the stockpiles of vaccines and medications, instruments that we need, and overall the beds that we could use for the people that needs to be into the hospital, and to be ready with the respirators that are very important when you have a severe case.
Right. And how did the U.S. and Mexico and the Center for Disease Control, you really entered into a bilateral agreement. Could you share how did that work? How are you going to take the lessons from that and possibly apply it to other areas?
Well, CDC support us very much for the diagnosis of this new virus on April. And now we're working together all this month for the several strategies that we are going to put in place in Mexico and the United States and Canada to, we are working together to preparing this new plan of preparedness against the new wave. And we have a very good relationships with them, and the cooperation is essential, I think, to do face for this new threat that we have.
What kind of grade would you give the Mexican government for its handling of the H1N1 flu?
What kind of what?
What grade would you give? How looking back, are there some areas where you would improve upon? Are there some areas that you would take away that you would offer as an example to others?
Well, I think that the reaction of the Mexican government was quite well, because we have been prepared during the several months, waiting for the other virus. But anyway, the preparedness plan was the same. And I think that the cooperation with other countries was essential. And now the actions that we did it, we think that was very well done, because if we don't close the schools or do it another actions, we never stop it as so fast that we did it, the first outbreak.
Right. And how do you continue to monitor H1N1? It obviously reached a peak in spring, but we're preparing again for fall and winter. What are you doing to monitor it in Mexico?
Well, first of all, it's very important to have a very good surveillance strategy. That means that every one of the states in the Mexican Republic has the possibility to put into the place the notification of the new cases. And for that, it's essential to have the laboratory working. And now most of the states has this possibility to PCR, to have the microbiology diagnosis at the time that we need it.
And do you feel Mexico is prepared to deal with the new onslaught? I mean, the headlines tell us that we're facing an epidemic. Do you feel that your country is prepared?
I think so, because, the lesson learned was very important. As I told you before, that the aggressivity of the virus is different, fortunately. And we prepare it because we know what were our deficiencies. We now has more knowledge about what can we do in the case of, because you know, the plans are always the plans,
Right.
but it's very important to live the experience. And when you have had living this experience, you have much better preparation for everybody. And overall, what's very important is the information that the people has now. The people know that they must cooperate on cleaning their hands or cleaning the surface, to avoiding the shaking their hands or the kissing, or avoiding the speed, and several things that are important to have good prevention of the transmission.
Right. Secretary José Ángel Córdova, this has been a real pleasure talking to you. You've done a tremendous job in Mexico. I think people feel much more confident as we head into fall and winter, knowing that we've learned a lot of lessons from this past spring. Thank you very much for joining us.
Thank you for your pleasure.
I'm Karen Hanratty. This is Focus Washington. Join us next time.